Parents in the East Bay upset after learning that their kids were given the wrong dose of the COVID vaccine. This mix-up happened over the weekend at a Sutter Health vaccination clinic in Antioch.
You can understand their upsetment. Ground 4's Philippe Djegal explains why an infectious disease doctor believes the children will not suffer long-term effects.
The father of 2 kids says his children were administered the incorrect dosage of Pfizer's pediatric COVID-19 vaccine in Antioch. At this time, he says both are recovering from severe stomach aches, but adds most of the pain has now gone away. The kids were inoculated over the weekend at a Sutter Health facility on Lone Tree Way. UCSF infectious disease specialist Dr. Peter Chin Hong says they should survive without long-term effects.
They're very much likely to be okay.
The children's father believes they received slightly less than twice the dosage intended for their age group, and they're not alone. In fact, Sutter Health confirms 14 children received the incorrect pediatric dose. In a written statement, Sutter Health says the patients, quote, received vaccines with an incorrect amount of diluent. As soon as we learned of this, we contacted the parents and advised them of CDC guidance in this situation. The safety of our patients is our top priority, and we immediately reviewed our processes to help make sure this doesn't happen again.
Basically, with kids, you just want to give the smallest dose that can give you the same immune response, and that's why 10 was chosen. But they also looked at 20 and 30.
Dr. Chin Hong says even if the kids were administered 20 to 30 micrograms of the vaccine, rather than the 10 micrograms they should have received, all 3 dosages were tested during clinical trials with no deaths.
Remember, again, this could have been the dose that they had chosen for pediatric populations. It's just that the 10 micrograms gave the same benefit in terms of immune response.
In order to be fully vaccinated, Dr. Chin Hong says the kids will still need a second dose of the vaccine to trigger an immune response. In Antioch, Philippe Djegal, Ground 4 News.